Assalamu alaikum everyone. I hope you all are doing well. Welcome to Mental Health Care Group. Today we will be talking about depression in women, and we will be talking about why the awareness related to depression is very important. What are the factors that affect many women, and what are the common symptoms, and what are the risk factors. First of all, depression in women is a serious and it is often a silent struggle. Many women, they go years into this thing without recognizing their symptoms, or for example they just push them aside because of family, because of work, or maybe because of their cultural expectations. So today we will be raising awareness to understand this condition more deeply. So first of all, we will talk about why depression affects many women. So there are biological factors, for example, because there is a hormonal shift during menstrual cycle, during pregnancy, postpartum period, and during the menopause, which can influence their mood and also their emotional stability. Secondly, emotional load, because women, they often carry multiple roles. They are mothers, they are daughters, they also work, for example, or they are also caregivers. This lead to emotional exhaustion, because if a person is just giving and giving and giving and not getting anything back, this can also lead to depression. Then we have social pressures. For example, most women, they are frequently expected to be strong or patient or giving, which can lead to ignoring their own pain or suffering, or if they are neglecting anything. Another factor is the high functioning depression, because many women, they continue working or caring or doing all the things and smiling while they are silently battling inside, and this make their depression harder to spot. So there are some common symptoms which often get unnoticed. For example, during depression, they have deep fatigue that doesn't go away. They have irritability. They have emotional sensitivity. They're probably feeling overwhelmed by even a small task. There is a loss of interest in things which they used to enjoy once. Body aches, headaches, stomach issue without any clear cause. There is also problem in sleep, either it's too much or too less. Or for example, appetite changes, same, too much or too less. Emotional numbness, where they say, I feel nothing. They probably have guilt. They, get involved in self-criticism, or they feel like a burden. And there are chances that they withdraw from their loved one. Once they were talking to friends and family and going out and doing stuff, but now they just get into their shell. So all these symptoms, if they're lasting for more than 2 weeks or 15 days, it means that this person is suffering from depression and they need to take consultation, or they need to contact a psychologist or a doctor. There are risk factors, especially in women. For example, during postpartum changes, whenever there is relationship stress, or for example, emotional neglect. When they lack support, when they go through some trauma or any stressful life event, when they have been taking care of other people, or there are long-term responsibilities. Workplace pressure or in financial stress could also be one of the risk factor, or for example, the cultural shame which is around expressing their emotions. Now, why awareness matters? Because many women, they don't say I'm depressed. Rather, they say I'm just tired. I can't handle anything today. I feel empty. Or they can also use sentences like I'm trying but nothing feels right. So awareness is it not just help us to recognize these signs in ourselves, but also in the women around us. So for this week, we have a gentle reminder that depression is not a character flaw. It is not a sign of failure or weakness. It is a real mental health condition, and women, they deserve support, understanding, compassion, love, and care. Take care of yourself and your loved one, and also spread these words to other women so if anybody needs help, they can get it. Thank you so much. Have a good day.